is that we've seen our patient satisfaction scores go up, and we've been able to sustain that. And then we have something called hot comments, and we have seen our hot comments going to more positive, and that's been something that we've also been able to sustain.
And I think it was probably maybe about clinic 5 or 6. The additional benefit we had was we started to see the patient satisfaction scores improve.
We're even higher, 95 percentile and higher now as a result of voice. And we're not only getting the percentile ranking, we're getting the personal statements from the customer.
If we had a way to measure coworker relationships, I could probably give you an increased score on that, because I do see staff relating better to each other and utilizing the voice skills.
We have a manage a help desk, which we take about 5,000 calls in a month. About 60% or better of the employees that they interact with have seen a big improvement.
I'm learning how to interact with my patients and with their families to draw them into their plan of care, so that it's not just me and a doctor telling them what they need to do or what needs to happen, but it's bringing them into that team. So myself, the doctor, the other staff, and the patient and their family can all be a part of the healthcare team, so that the patient receives the highest quality of care that they can.
And just walk around this place and see it being put to use every day.
And I also do the surveys, so I can see the comments that people have made on how it's working and how it's being reinforced, and people are glad that we've been given this opportunity, and it just is enlightening.
It's something that it's done over several weeks, so that you're building on those skills. And I think rather than having 1 or 2 classes and then you're done and everybody goes out and is supposed to use that, with the clinics we're building those skills and we're emphasizing them and re-emphasizing them. So I think it's something they get to practice and practice and practice, and I think that practice is key.
Initially, leaders were skeptical. Leaders were not sure how they would be able to manage this additional workload. It was exciting to hear them after the first round of training, and then the first round of them training their staff. They were saying things like, well, it's not so bad. These are pretty easy. They're easy to follow.
We just did Clinic 7, and there's a lot of role playing in that, and that was a lot of fun, because they get to be empathetic or they get to be angry.
I'm absolutely having a lot of fun with the skill clinics. I like the fact that they're very interactive. It's not just a lecture style. The staff really enjoy being interactive and being able to use those skills in the clinic and learn the skills and then apply them immediately afterwards.
If there's other hospitals thinking about doing voice skill clinics, it's a very simple statement: just do it. There's never a great time, because we're always busy, but there's always the best time, which is just right in the middle of all of those busy things, because these things will directly help you save time in the end in order to effectively do a better job at all those things you're trying to do a better job at.